got my injections. And I'm starting to get some flushing in my face. Good morning, y'all. It's a gloomy, rainy day here in Tampa Bay. As Jed and I would say, it is a good day for ducks. Anyways, today I'm going to see my allergist immunologist for a follow-up and to get my third Xolair injection. And what is Xolair? It is a treatment that works by binding and neutralizing the IgE allergic antibodies in the bloodstream, which is basically a substance in your body that can contribute to allergy-related issues. It was mainly created for persistent asthma and chronic urticaria, which are hives, but like many treatments on the market nowadays, it's been known to help with other conditions like mast cell activation disorder and idiopathic anaphylaxis, and it's in those areas that we are really hoping to see improvements with myself. Previously, we didn't notice any changes whatsoever with the shot, nothing positive or negative, but recently, I think I'm finally starting to see some benefits in the asthma department. Not exactly what we were going for, but my asthma does tie into my mast cells, so any slight benefit we're gonna take as a good sign. And so with my asthma, I've noticed I'm not as sensitive to my known triggers like cigar and cigarette smoke. We were at Disney the beginning of this month and we got caught in the firework fallout, which is kind of like a smog fog that happens if it's humid after the fireworks display. And I didn't need my rescue inhaler, so that is awesome. In regards to my mast cell itself and the reactions and such, I haven't really noticed a difference there. And that's okay because it can take several months to really notice improvements and see changes. And I think we said we're going to reevaluate whether this treatment is good for me or not at the 6-month mark. And since we're already seeing good signs in the 2 to 3 month mark where we're at now, I think I'm going to continue to get benefits from it, or at least fingers crossed. Unfortunately, I did have that severe anaphylactic reaction that warranted a trip to the emergency room, so I'll be discussing that with my doctor. You know, a lot of the time I get asked, what triggered your reactions? Do you know? And after a lot of testing, dieting, and journaling, my reactions have been classified as idiopathic, meaning no known cause, but to a sense, we know where they originate from. So my reactions come from my immune system not functioning properly. My immune system will start this process of ramping up and becoming hyperactive. That exacerbates my mast cells, and that is what creates the allergic reactions I have from my mast cell activation disorder. But we say idiopathic because my faulty immune system, when it starts that process, we don't know when it's going to happen, and there's no way to prevent it. But that is why we do treatments to help me manage this as best we can. You know, I'm on a few medications, and we started IVIG, intravenous immunoglobulin, which was a huge game changer because that helps my immune system regulate itself more effectively and become stronger. So that was basically treating the main issue there. And now we are doing Xolair. Hopefully in a few months' time, I'll really start seeing more benefits. I actually have a lot of hope riding on this injection today because my mast cells have not been controlled lately, and one of two things are happening. Either the last injection has worn off and I simply need the next one, which I really hope is the case, because the alternative would be that I am heading into a flare with my mast cells, and those can become very severe and very dangerous for me. All the signs are there. I'm not sleeping well. I'm waking up with flushing and fevers. My symptoms are more frequent reactions. They're a little bit more severe than usual as well. More abdominal swelling and distension. It's even happening in my face from time to time. The other day I had a reaction and I managed it at home, but my abdominal swelling was so severe and painful, I thought I was gonna have to go to the hospital to help manage it. And just the thought of having to go back to the hospital, the fear and anxiety was overwhelming, and it can be so frustrating to live in a body you cannot control and that doesn't cooperate with you. But I'm not going to give up, obviously. I'm thankful for a dedicated medical team and treatments. You know, we're not out of options. Just got to find a way to keep moving forward. So that involves getting this injection done. On the way, got my beautiful mother here. Let's do this. Come here. Carla, finish. Finish. Harlow, under.
Jacqueline?
Good girl. Got my injections. I am not a fan of needles though, and I particularly dislike the Xolair shots because the substance is really thick. So you feel it going in and it's super slow to inject, but it's fine. I got 150 milligrams, 150 milligrams, and I don't know, for some reason this time I'm bleeding a little bit, so I don't want to put my sweater back on because it's white, but all is well. And then in 4 weeks we come back for the next set of shots. And
do we have to wait longer?
Oh yeah, that's what I was trying to remember. No, the first time we had to wait 2 hours to make sure I didn't have any issues. Then the second shot was an hour. This time it's only 30 minutes. We got the timer going. And then the next time I think it's another 30 minutes, and then we only have to wait 10 minutes. Harlow behaved very well. Mom, show them how you hid your face. My mom hates needles, so she was hiding. We had a really great appointment with my immunologist. We're all just really hoping and praying that what my body needs is this Xolair injection, and I'm not heading into a flare. But since I'm not doing so well right now with my mast cell, she did change up my H1 and H2 blockers, my histamine blockers. And then I talked to her about the abdominal edema, like the distension, the swelling, and how it comes in my face too sometimes. And she said it's just part of how my mast cells are attacking my body right now and how my disease is presenting itself. And really the only way to get a good handle on that is to get a good handle on my mast cell activation disorder, because that swelling presents itself with my symptoms of mast cell when I have a reaction only. So that's what we're trying to do, get a handle on these nasty mast cells. I don't know how well y'all can see it on the camera, but we've been here like 15 minutes now into the timer, and I'm starting to get some flushing in my face. Not a huge deal, but a little concerning, so my mom went to grab the nurse and possibly a doctor. All is well. The nurse and my doctor came back in, said my face is definitely flushing. They thought it would be good for me to push some Benadryl through my port, so I did a small quarter dose and all is fine. However, we had to restart the timer and now we need to stay an hour instead of 30 minutes just to be safe, which I appreciate. They're looking after me. And my allergist is ordering some blood work to further look into my symptoms, just again, being safe, making sure all is okay. Flushing is a symptom that can happen pretty commonly after getting a Xolair shot, which is why they like to keep patients here for a time to make sure they're okay. I haven't had that happen before, but it could also just be my mast cells being my mast cells. So it was just tiny hiccup, nothing too serious. Definitely not enough to warrant discontinuing the Xolair because the benefits still outweigh the risks. You know, no treatment is perfect, but this definitely hasn't made me worse. And we're hoping I'll just continue to get better. And we're gonna continue with it every 4 weeks. If you're wondering why I don't pre-medicate with like Benadryl beforehand, my allergist just didn't want to, because typically you don't have to pre-medicate, and we just wanted to know that my body can tolerate it with little to no side effects, which so far so good. And now we just got about 20 minutes left and then we can leave. My mom is crying.
It's so funny.
I have just introduced her to the world of Drew Lynch. Oh my gosh.
No, I have seen it before because you showed me, but it's so funny. Yeah, you have showed me what.
Drew Lynch is my favorite comedian.
I like the dog better.
Oh, Stella. Her commentary.
Stella has very good comments.
Oh my gosh. is the best way to recover after a little scare, just laughter. Okay, let's keep watching. 2, 1. Ta-da! All right, let's go. Injections done. Next appointment scheduled. Thank you for going with me, Mom.
You're welcome, baby.
Now we are headed home. What? Well, I've got 2 blankets and a hippo who decided to lay on me. I think it's a good spot for her. This is my most consistent side effect from the Xolair. A few hours after I get the injections, I just become extremely weak and lethargic, and I kind of stay that way for the rest of the day, and then I'll wake up tomorrow and the side effect will be gone. So I know on Xolair days I don't plan to do much else except this. I'm also back in my PJs. I was very close to going to my appointment in basically pajamas. And there's no shame in that. You gotta do what you gotta do. But for some reason, I just wanted to put myself together a little more, make a little more effort, put on a nice outfit, and it made me feel happy. Just depends on how I'm feeling on any given day. And I decided that even if a flare is imminent, I'm not going to dwell on it. I know the signs are there, but I'm just going to take things one day at a time, because maybe tomorrow, which is a new day with new possibilities, I'll be headed in a better direction. And if things continue to progressively get more difficult, then I'll handle that as it comes as well. Just gotta aspire, strive, and take things one day at a time, because that's the most manageable way to do it. No point in stressing about something that hasn't occurred yet. So that's a Harlow nose sneaking into the frame. You're adorable, hippo. So yeah, one day at a time, enjoying whatever moment I find myself in and being thankful for what I have. And right now, I am grateful for a comfortable bed, snuggly blankets, and a lovable pup. So with that, I'll say goodbye, and thanks for joining us on our adventure.